And we are live. Hi, good evening, everybody. Welcome to She Built It Boss Lady Chronicles. I am Sharita Gaskins-Millette. I am your host. And this is the show where we feature the extraordinary stories of everyday women who are owning their power to transform their lives. And I am super excited about tonight's guest, super excited about the conversation because this is a very, very necessary area and something that we definitely want to highlight here in the month of May, but all the time, because here we want you to thrive. We don't want you to just survive. So I want to give a few minutes for other people to come in. While you're waiting, if you are watching us live, say hi in the comments. Tell us where you're watching us from. Put your questions in the comments. We're happy to pause to answer questions. If you're watching the replay, hashtag replay, still tell us where you're watching us from and still put your questions in the comments because I am happy to pass them on to our guest. And also, just a reminder that registration is still open for A Weekend for Me Jamaica, the premier wellness experience for professional women taking place June 20th to the 24th in Discovery Bay, Jamaica. And this is going to be an amazing time. So 4 days of concentrated me time in the lap of luxury. There's a full dedicated staff to take care of us. You won't have to worry about anything. Once you step off the plane, you have no more worries until you step back on the plane. So if your schedule allows, I would love to host you, www.aweekendforme.com. So let's jump right in. I'm going to introduce our guest, who is no stranger to us. She's actually part of our Facebook group and a friend of mine, Dr. Jeannie Lawrence. So Dr. Jeannie is a board certified psychiatrist and transformational life coach. She is the founder and CEO of Sanctuary Life Coaching for Women Physicians. She is also a national speaker and the co-author of the bestseller Made for More: Physician Entrepreneurs Practicing Medicine and Living Life on Their Terms. Her mission is to empower women physicians and professionals to create lives that feel as good inside as the world sees on the outside. Welcome, Dr. Jeannie.
Hey everyone, thank you, Dr. Sharita, for having me. This is such a treat.
Yeah, I'm really excited to talk to you. And I mean, just reading your bio excites me. Thinking about your mission to help, help women have lives that feel as good on the inside as they look on the outside. So thank you for doing that work because, like I mentioned before, one of my goals is to see women thrive and become everything that they were created to be. So thank you. I love our synergy.
Absolutely. I love our synergy too. It's such an honor, honestly, to be able to do this work.
Yes. So usually I start with asking a little bit about your journey, like how you came to do the work that you do now. I know you're trained as a psychiatrist, but what prompted you to move into this coaching space and to take on, women's, I guess their internal life, trying to help them match their internal life and their external life. What made you take on that work?
It depends on where we want to start the story, but of course, I'll start it with my own personal story. I started this work because I had come through my own period of burnout and my own period when my life looked different on the outside than it felt on the inside.
Mm.
For me, I was going through lots of transitions in a really happy, exciting time of life, right? Like after residency and my first job, just married, just moved, all of these things, and all very, very happy things.
Yeah.
But what I found was that inside of that happiness, there were a lot of things that I didn't have any support around, things that were different and new, and felt like I couldn't really reach out for any support with that. Felt like I should be able to figure it out on my own, and felt like I would be betraying someone else's expectations, right? If I reached
Mhm.
out for help and support. And so getting through that period and thriving on the other side of that is what prompted me in 2020, part of what prompted me in 2020 to start blogging about it, because I wanted to share my personal transformation with other women and other people who might be finding themselves in a similar position where, again, things looked good on the outside, but didn't feel great on the inside. And I started that blog and started putting that out into the world in 2020, right around the time that the COVID pandemic was starting off. I felt like it would be a really nice way for me to contribute, right? Because I was
Yeah.
talking about mental health and personal growth and wanted to contribute because the world was really upside down at that point and people were really afraid. And so in my sharing that blog, initially it was just family and friends, but then later I was sharing it among the physician groups that I was in, and it really started, what I was writing about was starting to pick up traction. And I started to notice by being in those groups that physicians, especially in 2020 with the pandemic, were really struggling, and it wasn't obvious to those on the outside, right?
Yes.
We were going to work, and a lot of physicians were on the front lines and separated from their families, and the COVID pandemic really affected us as a group very strongly. And so folks really resonated with what I was writing, and eventually I decided to try to create a service around serving physicians who were stressed and burned out and finding that their lives were not feeling as good on the inside as they looked on the outside. So that's how I kind of got here.
Okay, so now you mentioned that you found yourself in that space and you got out of that space, but you didn't tell us how you got out of that space.
Yeah.
So, what did you do? What kind of changes did you make? How did you come to that awareness? Because a lot of times you feel things, but you don't necessarily have language for it. And so it seems as though you managed to find language that said, okay, inside is not right, outside looks good, and I need to do something about that. So, can you tell me a little bit about how you came to that awareness, and then some of the steps that you took to bring yourself to a different place?
I think what was most pivotal for me was finally understanding my brain. Um,
Mm,
as a psychiatrist, you would think, right, that I just automatically knew, exactly what was going on in my brain and how the stories I was telling myself were affecting how I was feeling emotionally and how I was showing up in my life. But I really didn't make that connection
mm,
to myself, even though I made that connection, right, to
sure.
people and my patients. And I think that doctors fall in that trap a lot,
Oh yeah, absolutely.
where we can tell other people, give
Yeah,
other people great
yeah.
advice, but somehow it doesn't land for us. And so, again, what was pivotal for me was taking that kind of perspective that I would share at any point with a patient or a colleague, and applying it to myself, and realizing that it was a lot of the stories and the beliefs that I was holding that were holding me back and keeping me in a place where I felt emotionally like my life didn't feel as good as I wanted to on the outside. So awareness and understanding was really key. And then a decision, right? A decision that I was going to apply that understanding to the circumstances that were causing me to feel stressed out, and change
Mhm.
my perspective was really key. And then after that, talking about it with other people, sharing and finding that I wasn't alone in that, I think was
Yes.
really the thing that kind of pushed it over the edge, and actually finding meaning, right, in that period where things felt like a struggle, finding meaning and purpose in that now to help others kind of make that transition and that change too.
Yeah, I think you bring up a really good point as far as being transparent about some of the things that you're feeling, because I find, especially like with the retreats and things like that, that there are way more similarities in people's stories than there are differences. And but when we keep everything to ourselves, we suffer in silence, right? We think we're the only one who is experiencing this thing, or the only one who's going through that emotion. And sometimes we even think that it's some kind of shortcoming on our part, when in reality, many people are feeling the same thing. And, when you share it, it just gets it out there. You get support and you get validation.
Mhm. Yeah, absolutely. I think turning that my experience into writing and blogging, and then again sharing it with physicians and people saying like I've experienced that same exact thing, was a big part of totally of really addressing that and healing it, and then coming out on differently on the other side. So I agree
Yeah,
with you.
great. So tell me about your program, about the sanctuary. So I know, you said you started the blogs and all of that, but you actually have a program now for women physicians. Tell me a little bit about that.
Yeah. So Sanctuary is a transformational life coaching program for women physicians who are feeling overwhelmed, who are feeling burned out, whether it's in career or life or both, and who are looking, first of all, for a safe and soft space to land. A
Uh-huh.
lot of times, again, as a woman and a woman in medicine and a professional woman, there's such a high level of expectation that you continue to show up and do all the things and be all
Yeah.
the things to everyone. And sometimes there isn't a safe place to just kind of take off the mask and let our hair down and admit when we are having our own struggles as human beings. And so that's kind of the first thing, right? That sanctuary offers. But beyond that, through coaching and the specific way that I coach, after finding that safe space, we start to unlearn the conditioning, right, and
Mhm.
the patterns that have brought us to this place of burnout
Yeah,
and
that's
overwhelm.
huge.
Yeah, the people pleasing and the deprioritizing ourselves,
Yes.
and I could go on and on about all of
Yeah.
the
Yeah.
ways that we've been conditioned that lead us to that place of burnout. And we spend a lot of time exploring and unlearning that, so that on the other side, we know ourselves better and we can trust ourselves more to create that life on the outside that looks even better, but
Yeah.
now feels really good too. So
Right, right. Because, you talk about the stories that we tell ourselves. And so, we tell ourselves that this is just the way it is. This is the way it's always going to be.
yes,
Nobody else can do it but me. I'm the only one who can do it right. All of those kinds of things that kind of keep us trapped in this endless cycle.
yeah,
And so I love, the way that you're empowering, women to take ownership of some of these things, because we don't, at least I know I never thought about, before I started doing personal development work, I never thought much about my role in keeping myself stuck in certain kinds of situations. And so I think, pointing that out, highlighting that, and then giving women the tools that they need to be able to make changes, meaningful changes that, translate to transformation.
yeah.
I think that's wonderful. So the big topic that I really wanted to talk about today, as you guys might know, May is Mental Health Awareness Month, and mental health is so vitally important. And you've heard me say before that in order to be well, you have to be well, mind, body, and spirit. And if any one of those things is off, you will not be well. And our mental health is huge. When we don't have strong mental health, it affects our physical body. It affects our relationships. It affects our employment. It affects everything. And so one of the things that I had Dr. Jeannie on my last show, Level Up Lady Doc, or Level Up Live, as a part of Level Up Lady Doc, and we talked about what depression looks like in high functioning women. And I wanted to bring her back on to talk about that again now, because it is such a huge thing, and I wanted to bring awareness to it, because I think a lot of people don't know. When you think of depression, you have a certain image in your mind, but depression in high functioning individuals presents very differently. So, Dr. Jeannie, tell us first, I guess, what depression is, and then contrast that with what depression is or high functioning depression is.
Yeah. So first of all, I want to tell you thank you for carving out this space on your platform to bring awareness to mental health issues, especially here in May when it's Mental Health Awareness Month, because I think it's something that there's still so much stigma and not enough conversation, and opening up these conversations really gives permission to people who may be experiencing this silently, right, and behind the scenes, to raise their hands for help and support. And so I'm grateful for the opportunity to talk about this. So, mental or depression, right, we know is a very common mental health condition. The DSM describes it. I'll just kind of go through the criteria
Sure, sure.
as meeting 5 of these criteria, but low mood for 2 weeks at a time, a change in sleep. It can be sleeping much more than usual or sleeping much less than usual, change in appetite, again, more or less than typical, loss of motivation and pleasure in things that you typically would enjoy, difficulty with concentration, suicidal thoughts sometimes, as well as hopelessness. And also there's also some psychomotor changes that can happen, either feeling agitated or being slowed down to a point where people start to notice that you're moving differently. So that's kind of the by the book DSM
Yeah.
criteria that most physicians and clinicians and mental health professionals use to evaluate and diagnose a person with major depressive disorder. You asked how that might contrast or might present a little differently in folks who are high functioning. And so,
Well, I guess I actually want to know first, what do you mean when you say high functioning depression?
okay, yeah, great question. So, high functioning, the term kind of highlights, right, this idea that typically we expect someone with a significant burden of mental illness like depression to not function at a high level, right? The stereotype is that if you are depressed, then you're also really struggling to work, right? Struggling in your relationships, things like that. There's like a bit of, there are outer signs that people can see, and that may lead someone to offer help or make it obvious to someone who's evaluating you that you need that help and support. The term high functioning kind of contrasts or points out that there are some people who kind of surprisingly continue to be high functioning even while depressed. It's kind of pointing out that disconnect, right? Like
Okay.
depressed, but still able to function at a high level. So hope that answers that part of your question.
Yeah, yeah, it does. And so I interrupted you. You were going to tell us what it looks like.
Yeah. Um, So I think that distinction is important. I was sharing with you before we came on live that back in 2020, when I first started hearing the term high functioning depression, what was being written and said about it is that high functioning depression basically meant that a person is depressed, they're still functioning at a high level in their jobs and in their relationships and socially and things like that, and therefore they must only be mildly depressed. So everything that I was reading was basically saying that high functioning depression is the same as dysthymic disorder or pervasive depressive disorder, as we call it now, both of which is a mild form of depression. Does that make sense? Like
It
it was
does. It
basically
does.
saying that high functioning depression is the same as very mild depression. And what I was noticing, and as I read those descriptions back then, was that wasn't my experience and that wasn't necessarily true. And I was thinking about high functioning professionals like physicians
Yeah.
who I know very well. And I know that even at with a high level of depression that's moderate or even severe, continue to show up at work,
Yes.
continue to perform at a very high level, even outside of work and in all spheres of life, and so don't fit that mold, right? You can, in other words, you can be very severely depressed, but still continue to function at a high
Right.
level.
Right.
Um, was kind of unnerving about that, like that stuff that was on the internet, is that it was really a setup for physicians and other people who are generally high functioning to be missed, because
Yes.
folks would then assume that if they're going to work and doing all the things, then they must not be that depressed and therefore not need much or any support or help, when the exact opposite is true. So physicians and other high functioning professionals a lot of times are conditioned and sometimes innately perform at a high level. We have a lot of internal and external pressures to continue to
Right.
show up, regardless of how we're feeling and regardless of what may be going on inside, that can be kind of make it very difficult to detect suffering and struggle in that group. And so yeah, that's one of the things I think that should be pointed out, that we can't always look to level of functioning as a marker of level of severity of depression, especially when we're dealing
Right.
with
Right.
professionals. Yeah.
So I don't know if there's been any research into this or not, but what makes some people um, be able to function and function at a high level while other people almost shut down?
Yeah, I don't know that it's been very well studied. My hope is that as we start to open up these conversations, like again, like I mentioned, we only started even using that term like in the past couple of years. So my hope is that more research and science will go behind it. But in my work with physicians who are high functioning and sometimes struggling beneath the surface, a lot of what is driving that continued level of performance are a lot of the stories and things that we talked about at
Yeah.
the beginning,
Yeah.
and that you mentioned at the beginning. This idea that we should be able to do it, right? I
Yes.
was speaking to a client today who is in traditional clinical medicine right now, but very burned out, who described medicine as very masochistic as a
Mm.
culture, because it is really celebrated sometimes. This idea
Oh
that
yeah.
you go to work, with an IV pole, and she was telling
Yes.
stories of colleagues, right, who were sicker than some of the patients on the unit, but still showing up and a little bit of bragging about how they were, really needed
Right. Right.
really needed help, but went to work anyway and by any means necessary. And so that
Yes.
gets kind of celebrated, unfortunately, in medical culture, and it continues this narrative, right, that yeah, you're not a good doctor unless you're willing to
Right.
to
Right.
do
Right. To
that.
truly sacrifice your life. Like, yeah.
Absolutely.
Yeah. So
Um,
you mentioned burnout.
mhm.
How can we tell the difference? Well, actually, you know what? I want to back up a little bit because we haven't told the people yet what high functioning, some of the signs of high functioning depression, some of the symptoms. Because as I read the symptoms, they look very similar to burnout.
Mhm.
And so the question I was going to ask is how can we distinguish one from the other? But first, I think I want to let people know what kinds of things you might see in a high functioning person who's depressed.
Yeah. I find that you have to look very closely, and that work is not a good place to necessarily tell if
Yeah.
somebody is suffering with high functioning depression. But if you are looking more in their personal lives, right, and a bit behind the scenes, then you may see that things like, especially among women, like irritability and anger. And so what I hear a lot is like snapping at loved ones, snapping at the children more, snapping at their spouse more, having a shorter fuse than usual, is something to look more closely at.
Mhm.
Um, Another is this like coming home and just not wanting to be bothered. So being on
Mhm.
all day, right, at work, and again, nobody would be the wiser, but at home, like really wanting to isolate on the weekends or times off, like not having any thought or desire to do anything other than kind of cocoon, right, and to
Mhm.
be in bed and alone and by themselves, especially if that is different than what
Mhm.
their usual baseline is. Other kind of subtle signs: difficulty with making decisions, that kind of is a way that the change in concentration might show up, being really indecisive. Small mistakes at work can start to sneak through as well. And then lots of judgment about that, right? Like physicians,
Mm-hmm.
professionals are very hard on ourselves. And
Yes.
so making those mistakes and then really being harsh with themselves about it, and that kind of fueling a cycle of negative emotion around work and about themselves, feeling worthless, like they're dropping the ball all the time, that kind of thing, feeling badly about themselves. Hopelessness, I see hopelessness. They may not be voiced, but feeling trapped is like the way I hear it described.
Yeah.
I'm like, this is my life, right? And this is
Yeah.
my job, and I can't see anything different. Like I can't see my way out of it. Feeling really trapped and hopeless is another sign to look for. So some of those are some of the things that I would look for and have seen in folks who have high functioning depression.
Okay. And so then, how do we distinguish that from burnout? Because I know, burnout is a huge thing. It's more of a buzzword, nowadays. But, people in many professions are talking about how they're just working, 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 and they're exhausted and they're tired and they don't want to do it anymore. How can we distinguish, how do I know that I need to go and get help? Basically, is what I'm asking.
Yeah. So there's a very thin line, like we were talking about, between the two. I think sometimes people are more readily willing to label themselves or admit to burnout because it's a little bit more socially acceptable. It's not necessarily a mental health diagnosis, and unfortunately,
Sure.
there's still a lot of stigma. But I would say there's a very thin line, and between the two. The main distinguishing factor, right, is that burnout is a occupational side effect, right? It
Mhm.
comes from directly tied to one's work, and so you would expect then on breaks from work, or if you're on vacation, or maybe even the weekend, that you recover and you're kind of back to your baseline.
Mhm.
If
Okay.
it's burnout,
Yeah.
versus being kind of really unable to recover, even during periods when you have time away from work,
Okay.
still not getting back to your baseline, as being like kind of a sign that maybe this is more than burnout, is what I'd say there.
Okay.
Yeah.
And so when do I know I need to get help?
Yeah. So I would have a low threshold, is what I'm trying to say
Mhm.
when I
Mhm.
mentioned that there's a thin line. I think
Yeah.
sometimes you're waiting for waiting for something big or huge to happen. And by then, again, with physicians being so high functioning, if you wait till something major has happened, you've like gone very far. Right?
Right.
And so
Right.
having a lower threshold for seeking support, anything that feels different, right, in terms of your bandwidth, your mood, that irritability that we talked about, your ability to think clearly, make decisions, anything that feels like a shift, have a low threshold for asking to see your doctor and have it further evaluated, because again, it's so well hidden sometimes that waiting until things are big and bad is a mistake,
Yeah.
and it can be hard to draw it back in. So
Okay. So now what are some of the things that we can do to combat this, this um I guess the depression that's coming, or because we talked a little bit about how we play a role in our own um situation, in some of the stories that we tell ourselves and those kinds of things. So what are some of the things, some of the tools that we can implement that may be helpful?
yeah, you know, just to go back to what you said about like our contribution, right, to our own suffering. My way of like explaining that and thinking about that is like, yes, we have our own thoughts and stories and things like that, but I'd like to make it clear that even that is not our own fault. Like the
Mhm.
the culture that we live in really does
Oh gosh, yeah.
those stories. And so it's really like we're adapting, right, to a culture that's really harsh and that demands, superhuman expectations. It's almost like, of course, you would develop those kinds of thoughts and beliefs and stories, right? Because you're placed in a harsh medical culture, and then you're trying to adapt. So it's really an adaptation, is what I'm trying to say, and
Right.
in any way like blaming the person, right? Even if they do
Sure.
that story, because it's a natural consequence of having to working in that environment. Your question was what to do about that.
Yeah, like, if you are coming to an awareness that, okay, I am not thinking, I understand that I may be experiencing some level of depression, but I'm still functioning. I'm going to work. I'm doing the things, but I know I'm not necessarily thinking about things the right way. That I'm putting too many demands on myself. What are some of the tools that I can implement that might help me get better
Yeah.
or better cope with the situation?
Yeah. Um, there are many. I mean, I still recommend like working with someone,
Oh
because
yeah, sure.
from the perspective of trying to create solutions with a mind that is like tired and exhausted and burned out, kind of
Mm-hmm.
tired in all of these stories, because of the culture in which you work, can be really hard work. So it really does help to have an outside perspective to help you see your blind spots and help untangle some of those stories.
Okay.
Um, I would say that first. That aside, if you're looking for like kind of self-help strategies, or you're kind of in a place where um, you feel like things haven't gone so far, right, where you need to
Yes.
seek help just yet. Yeah, there are a lot of things that we can do. So I like to think of, most people talk about mental health and mental illness as like the presence of these symptoms, right? Like we kind of laid out the DSM-5 criteria, and
Yeah.
we talked about the burnout symptoms. And so there's this idea that mental health is like very black and white. Either you have symptoms of an illness and you need some help, or you don't have symptoms of an illness and therefore you're healthy and don't need help. The truth is that mental health is on a continuum. Um,
Absolutely.
yeah, and so it's not only the absence or presence of mental illness symptoms, but there's another continuum where we're looking at, do you have the presence of positive mental health markers? So
Mhm.
that's, positive emotions. Are you feeling at least on a regular basis, and fulfilled and happy and content in your life? And when you're not feeling that way, do you have tools to manage those negative emotions that absolutely come in anybody's normal life? Do you have relationships that are supportive, and do you have a connection to your community where you're doing work and being involved in a way that is meaningful to you? Are you doing work that aligns with your values, right, and helps you to
That's huge.
engage and
Yeah.
get into a flow state? Or are you just kind of doing what you're told to do and feeling like a cog in a wheel all the time, right? Like in your work as a as a clinician, as a lot of people do.
Right.
And so to answer your question, one thing that we can do to improve our mental health is to understand that it's on a continuum, and then also know that part of getting great mental health is increasing our positive mental health markers. It's not just about getting rid of the negative symptoms of mental illness. And increasing the positive mental health markers, we all can do that, right? I
Yeah.
just shared them, but yeah, relationships, spending time in nature, managing our stress through, walks and meditation, and being connected to our faith, being connected to like-minded, supportive people, and cultivating the tools to understand your mind. I said this was a part of my transformation.
Yeah.
Understand your mind enough where you're able to cultivate positive emotion and deal with negative emotions. All of those things are protective, and also can combat, even if there's already a presence of some depression and burnout symptoms there.
Right. So it almost sounds like I have this concept that I use in my retreats, which is creating a foundation of wellness.
Mhm.
And it almost sounds like that, where where you're caring for your mind, body, and spirit. You're getting out in nature, you're walking, you're exercising, you're meditating, you're praying, you're making sure, or you're trying to your best to make sure that your time is aligned with your priorities. That you're spending time on the things that are important to you, so that it doesn't create a discord inside. So it's almost like a general, it's like I said, a foundation of wellness, just a solidifying your well-being, so that you are better able to weather the storms when they come.
Yeah. Yeah, absolutely. I think that's a beautiful way to look at it.
Okay, so where do you see us going from here, I guess, is is the question, because we live in this world that is a hot mess. We've been through a pandemic. We've had a lot of social and societal unrest. We're in a very precarious political situation right now. So people are dealing with stresses from all directions. And then, speaking about physicians specifically, there's so much turmoil in healthcare right now. How do we get better? I guess is what I'm asking. How do we build that resilience that we'll need? And because we are losing a lot of physicians to suicide, and and other professionals too. But how do we um build that resilience, and how do we help each other, I guess, is also the question. If I, as a colleague, recognize that you don't seem to be doing well, how can we help?
So you asked a few questions in there.
We'll
um,
pick one. It's fine. I know.
yeah. I think one big thing is just having conversations like this, because there really is a culture of silent suffering and not sharing, and then nobody really understands that they're not alone when nobody talks
Yes.
about it.
Yes.
And so normalizing these discussions, I think, is really important. I've been encouraged to see more physicians out here in this wellness space, just sharing their own personal stories and how and struggles and things like that. And then more people are given permission to do the same. And I think that suffering really thrives when it's in the dark and
Yes.
when we're silent about it. But when we kind of share, normalize, turn on the lights, like see that everybody's a human being, then it opens the pathway for us to help one another, as you said. But we can't do it without talking about it. So I
Right.
think this is really a huge. It seems small, but it's a huge part of it. Yeah, I think that's actually the biggest part, is just having discussions like this and normalizing it, so people are aware. Being aware of places that we can go once we do decide, and do discover, like, maybe I could use some additional support, like having knowing what resources are available. So things like the physician coaches line, the physician support line, which is the team of psychiatrists that supports physicians who are struggling with their mental health, and all the myriad of resources that are out there, bringing some of that to the forefront, so that it's not hard to find when folks are ready to start seeking some help and support. I think is also a big key to all of this.
Okay. So if someone feels that they're having a high functioning depression, would it be beneficial for them to work with you in a coaching capacity, or would you recommend that they work with you in a clinical capacity first before they try to do the coaching piece?
That is very case
Ah,
dependent.
okay.
Yeah,
Okay.
very case dependent. What I would recommend is, scheduling a consult and then kind of fleshing that out together, because everyone is so so different, like in like what's underneath that. You know, the term high functioning depression is a big umbrella term, but like what the real issues are, you can't really ascertain until
Sure,
having that
sure.
one consult and then kind of teasing that out. So yeah.
Figuring out where to go from there. Okay, that makes sense.
Yeah.
All right. So, Dr. Jeannie, if somebody is interested in working with you, tell us where we can find you.
Yeah. I'm active on Instagram, Dr. Jeannie Lawrence, MD. Also on LinkedIn, my name again, Dr. Jeannie Lawrence, and on Facebook under my name as well. And then you can check out my website, which is also my name, JeannieLawrenceMD.com/sanctuary to find out more about coaching and working with me in that capacity.
Excellent. So, if there is one bit of advice that you would leave with, with these boss ladies tonight, what would it be like in terms of their mental health? One piece of advice you would offer.
My one piece of advice, I have a bunch of advice, but the one piece I'll leave is to use all of the tools at your disposal. So I have found that high functioning professionals and physicians and things like that, we sometimes are struggling, but we don't want to use all of the things at our disposal, right? So there might be
Mm,
a stigma towards the mental health piece. Maybe you feel more comfortable with the coaching piece. You know, whatever the case may be, but when you have access to all of the above, like why not use all of
yes.
the above, right? It's kind of you can like kind of struggle, you can like do the self-help thing by yourself, that may get you so far, but like why not like put like a little gas on the fire, right? And
Yeah.
help speed you along by enlisting the support of someone who can help you get to your destination, which is thriving so much faster than you can on your own. And for some people, again, they're a true like a traditional mental health component, like working with the psychiatrist, medication therapy, all of that might be a part of your journey too. Like don't leave anything off the table because
Right.
your end goal is to thrive. And so
Exactly.
be open to using all of the tools at your disposal. You'll get there so much faster. So
Yeah. Yeah. Thank you. I agree. Especially the part about community. I believe that we're all here to help each other. We were never meant to live life alone and in isolation.
yeah.
And so, reach out for help if you need help. Talk to people around you, talk to professionals. And, like Dr. Jeannie said, use all the tools at your disposal because we want to see you thrive. So I think that's it for tonight, guys. Thank you so much, Dr. Jeannie. I appreciate this conversation. Um, I will put all of Dr. Jeannie's information in the comments if you guys want to reach out to her if you have questions. Like I said, put them in the comments. I'll get the questions to her. And again, a reminder that registration is open for A Weekend for Me Jamaica, June 20th to the 24th, www.aweekendforme.com. We would love to have you, and we will see you next week. Take care. Have a great night. Thanks again, Dr. Jeannie.
Thanks for having me.